When we look at the diagnosis, also here we see that PDD-NOS, oh, it's far out. Oh, it doesn't. Sorry for that. Back. I have to go back. Yes, here we are. You see far more PDD-NOS, autistic disorder in 37% and Asperger in 30%. When you look at this slide, you see how many times one item is scored as a defining criterion for one of those diagnoses. And you see it's almost similar, only restricted interests, and here you see a difference in preoccupation. You see that only those two are also significant. What you see on this slide is the differences in criteria. You also see there's no difference in boys or men and women on social interaction or the communication or the stereotype behavior. And you also see that there is no difference again here, but the interpretation is that women need more criteria to be diagnosed, and the social expectations of the women is higher. Let's look at the comorbidity. Here you see the comorbidity of the PDD-NOS and Asperger group compared to autism, and you see they're almost the same, but not on the psychotic issue. You see that in psychosis is seen in PDD-NOS four times more often than in the general population. When you look at the gender and the comorbidity, you see differences, especially in mood disorders and, again, psychotic. This one is significant, that one isn't. But what we also saw is that they have far more, the women have far more life events than the men. And those life events are most of the time sexual abuse. Let's look at the correlations of the comorbidity. You see here they are not very high. I want only to point out two of them. You see a negative correlation with substance abuse, and it's comparable to a study another researcher of our group has done, from CISO, because when the more substance you use, you better have, the better the social interaction gets. And that's one of the reasons why a lot of people with autism spectrum use drugs or alcohol. And for the communication, the other red figure is the other way around. So what can we conclude? Diagnosing ASD in women is difficult, especially in milder cases. They have higher levels of comorbidity, and clinical expression is that it plays a blurring role, but has to be confirmed in other studies. And I can't say it enough, and I want this to as a take-home message: be acutely aware of signs of abuse and misuse in girls and women. was because a great deal of them suffer and they cannot express or dare not express themselves. What can we say when you put all the presentations we did and all the studies we did together? Let's have some general conclusions. There's more autism spectrum disorders in young girls. And there's more PDDS in women. When you look at the comorbidity, you see the affective comorbidity in females in all ages. In boys, there are more externalizing problems, and in men, more internalizing problems. When you look at psychosis, it occurs in 1 to 20 adults with PDD-NOS. But be also aware, and that is because I work in the addiction clinic, that a person with PDD-NOS uses drugs, he gets psychotic by that. And it is not a separate illness. So be aware of that, because they can look very psychotic, and I see many times in our clinic they were diagnosed with schizophrenia. And there was just a PDD-NOS person which was using drugs. But at all we have seen, we have to say what we did was a series of cross-sectional studies. And of course, it needs to be confirmed in a longitudinal design. I want to thank Martin de Kanter, Wouter Groen, and also Fleur and Iris to help us with all the work we are presenting today. And of course Patricia van Deurzen. And of course you for your kind attention. Thank you, Patricia. Thank you.